Hello everyone, I am Dr. Bharathi, Professor and Head, Department of Otorhinolaryngology Head and Neck, JSS Medical College, Mysore, and also past President of National Association of Otolaryngologists of India. World Hearing Day is a campaign held by World Health Organization on March 3rd every year to raise awareness on how to prevent deafness or hearing loss and to promote ear and hearing care for all across the globe. This year, the theme is Changing Mindsets. Empower yourself to make ear and hearing care a reality for all. What exactly this means? That is, we need to sensitize the healthcare system and public towards hearing health so that they promote early detection, safe listening practices, and accessible hearing healthcare for everyone. Hearing disability can be hearing loss or deafness depending upon the severity of hearing disability. Either it can be from slight to severe when we call it as hearing loss, and more than severe, that is more than 70 decibel loss, we call it as deafness. There are three types of hearing loss, that is conductive, sensorineural and mixed. In conductive, the pathology lies in the outer ear or the middle ear, whereas the sound waves cannot be transmitted to the inner ear. In the inner ear, in the sensorineural loss, the pathology lies in the cochlear hair cells or the auditory nerve or the auditory cortex. Then in the mixed type of deafness, both conductive and sensorineural loss coexist. Depending upon the degree of hearing loss, we have slight, mild, moderate, moderately severe, severe and profound deafness. How the hearing loss affect the individual? It depends on at what age the affects the individual. If the child is born deaf, then it will affect his speech development and the cognitive skills, and the child will be a deaf mute. If it affects at a later age, then it will jeopardize in all aspects of his quality of life, like education, then job opportunities and socioeconomic status. If it affects in elderly age, then they will isolate from the society and early onset of dementia will be there and cognitive skills will be less. So this is how it jeopardizes the life of the individual at various levels. Now let's see the common causes for hearing loss in children. It can be described under congenital and acquired. In congenital, we have genetic causes wherein 85% of them are non-syndromic and they are autosomal recessive, whereas the remaining are syndromic, and the common syndromes which affects the sensorineural system are Down syndrome, Alport syndrome, Usher syndrome. Then acquired causes can be described under prenatal, natal, postnatal. In the prenatal, the maternal infections in the first trimester of pregnancy with toxoplasmosis, rubella, cytomegalovirus, herpes simplex, or maternal metabolic disorder like diabetic mellitus, hypertension or hypothyroidism, or if the mother is exposed to ototoxic drugs. And then in the natal, it is the birth asphyxia or the low birth weight child. And then in the postnatal, immediate postnatal will be sepsis and then neonatal hyperbilirubinemia. Then later in life, it can be recurrent acute otitis media or secretory otitis media, then exposure of the child to ototoxic drugs or meningitis or infections with mumps and other viruses, and these are the common causes. Now let's focus on one, that is a child born with congenital deafness. How are we going to identify this case? Actually, there is now government has made compulsory that every child born should be subjected to universal newborn hearing screening program. That is the evaluation of the child cochlear hair cell with otoacoustic emissions. A child born should be tested with OAE and then if it is pass, it's okay. If it is refer, that is if it is negative, the child should be re-evaluated again, and then its automated ABR can be done, and at the end of 1 month it should be again re-evaluated, and if the child still fails the OAE and the automated ABR, then the child should be given the hearing aid, and at 3 months it's fitted with the hearing aid, and 3 months trial of the hearing aid should be given, and then habilitation should be done, and at the end of 6 months it should be evaluated. If there is no improvement in the hearing, then the child is a ideal candidate for cochlear implantation. So this is a rule of 1, 3, 6. Earlier we do the cochlear implantation, better is the result of hearing as well as the speech development, and FDA has approved that, and 9 months or within 1 year we can do it, and best results we can get within 2 years also. But later on, because of the neuroplasticity, then even though we do the cochlear implantation, then the skills, the intellectual ability will not be as good as if it is done within 1 year of life. And now there are various government schemes, the central government scheme as well as the state scheme, which promotes the newborn the cochlear implantation. And with these few words, I like to emphasize we all should work towards the ear and hearing care, so that we'll have a good ear health, which will help us to live to the full. Thank you.